This figure from the PSA shows the leading causes of death in the Philippines, and ischemic or coronary heart disease is still the #1 cause in the recent data. In US, about 1 out of 3 deaths is due to cardiovascular disease. That's why preventive treatment for these conditions is really important. The problem is, we tend not to give so much importance in the prevention until the point when we already have that disease. Coronary heart disease and other cardiovascular diseases are most often caused by atherosclerosis. The artery walls become progressively thickened and narrowed due to fat deposition, mainly composed of cholesterol. So in this video, we will talk about blood cholesterol, how to improve it through dietary fats, and hopefully prevent cardiovascular disease. These are all the major risk factors, but we will focus on the modifiable ones and know what to do to help prevent this disease. The American Heart Association notes that poor diet quality is #1 risk factor for death and disability in the US. When we have our lipid profile test done, we have values of the following. Triglycerides are stored in fat all over the body, and high levels of it are often found in people who have high cholesterol levels, heart problems, obesity, or diabetes. Cholesterol is assembled in the liver, released in the blood, and travels by way of lipoproteins known as LDL and HDL. LDL is the bad kind, which deposits cholesterol in the artery wall, forming plaque, while HDL is the good kind, which removes cholesterol from plaque and bloodstream and helps protect you from heart attack and stroke. The higher the LDL levels, the greater the risk for the development of atherosclerosis. And clinical studies have confirmed that lowering the LDL can successfully reduce coronary heart disease mortality rates. Reducing saturated fat intake by 1% can be expected to produce a 2% drop in heart disease risk by reducing LDL cholesterol. The problem is that more than 1/3 of the fat in most meats is saturated, and more than half of the fat is saturated in whole milk, cheese, butter, cream cheese, sour cream, and ice cream. So how do we lower the bad cholesterol in the blood? Some of you may have heard confusing advices about dietary fat. Eat less fat, but eat more fatty fish. Give up butter, use margarine, and then give up margarine and replace it with olive oil. Avoid saturated fats, but increase omega-3 intake. Stay away from trans fat and then stick with mono and polyunsaturated fats. No wonder why some people feel confused about dietary fats. It is because some fats support health, whereas others damage it. For patients who need to lower their LDL cholesterol, it is recommended to reduce the total calories from saturated fat and trans fat and have regular aerobic physical activities. A diet that is rich in vegetables, fruits, and whole grains, and includes the moderate use of polyunsaturated and monounsaturated food fats is the basic guideline. People with high cholesterol, even after a diet and lifestyle change, are often prescribed with medications to help lower their cholesterol. That's why you still have to consult your doctor. We will now explain why some of the popular beliefs about blood cholesterol are not correct by busting the fatty myths. Myth #1, you don't need your cholesterol checked until you reach 40. It is recommended to have your blood cholesterol checked every 5 years, even before 40, and more often if you have risk factors for heart disease. Myth #2, only overweight and obese people have high cholesterol. People of any body type can have high cholesterol. Being overweight or obese increases your chances of having high cholesterol, but being thin doesn't protect you from the problem. Even without overweight or obesity, high intakes of solid fats increase the risk of some chronic diseases. Myth #3, your cholesterol level is only a result of your diet and physical activity level. Yes, it's true that diet and physical activity affects your cholesterol levels, but they're not the only factors. Getting older and being overweight also impact your cholesterol level. Some people are even born with high cholesterol. Regardless, it is very important to have heart-healthy diet and get plenty of moderate intensity physical activity to reduce your risk for cardiovascular disease. Myth #4, you don't have to improve your diet and lifestyle once you are taking cholesterol medications. It is important to take your medicine exactly as they are prescribed. But the best way to reduce your risk for heart disease and stroke are to eat a healthy diet and include regular physical activity even if you are already on medications. Again, with the guidance of your personal doctor. So next time you have your blood cholesterol levels checked, you already know what the values mean. And remember, you can modify your diet to prevent atherosclerosis and cardiovascular disease. I hope this information helps. Next time we will talk about fasting, and if you're interested, click the notification button so you won't miss it.